This is the Registered Behavior Technician course presented by Shaza Attar. The course content was created by Shaza Attar and is the property of Autism Therapy and Training, Inc. All rights are reserved. This training program is based on the Behavior Analyst Certification Board 2018 RBT Task List 2nd edition and is designed to meet the 40-hour training requirement for the RBT credential. The program is offered independent of the BACB. Remember, in each class, we will have our active listening, a quiz, and a competency assessment. Hello everyone, and welcome to today's class. Today, we'll be identifying essential components of a written behavior reduction plan and describing the common functions of behavior. I want to start off by reviewing something I put together at the center specific to handling problem behaviors and something for you to keep in mind. This states that Autism Therapy and Training and the treatment team have a commitment to providing support for people with a disability and challenging behaviors. The center recognizes that all people can learn and develop skills to become confident and competent members of the community and who have a valuable contribution to make throughout their lives. In the best interest of the clients, the center will ensure that positive, non-intrusive, legally and ethically acceptable strategies are adopted in the management of challenging behavior. In order to protect client rights and maximize opportunities for participation in community life. It also states that Autism Therapy and Training places great emphasis on promoting the dignity, worth, and rights and developmental potential of people with disabilities. Client rights and ethical principles should always be considered when adopting any strategy that relates to the management of challenging behavior. Not all behaviors need to be modified, and therefore, it is less urgent to intervene in some situations than others. Intervening to change a person's behavior is, in a sense, interfering with that person's autonomy. In managing challenging behavior, staff should always use the least restrictive alternatives. Any action taken to benefit a person with a disability should intrude as little as possible on their rights and lifestyle. Challenging behavior can serve as a form of communication for individuals. It always occurs for a reason and usually carries a message to those around them. There may be a number of interrelated causes for the behavior, although sometimes the causes cannot be easily determined. All therapists are required to manage problem behaviors that occur from time to time. It is our top priority that both the therapist and child remain safe at all times. Something to keep in mind when the topic of problem behavior arises is that just because we as practitioners or parents don't like a behavior doesn't mean we must intervene. If a learner is engaging in hand flapping from time to time, must we intervene? Is the behavior interrupting their ability to learn? These are questions we need to keep in mind when we're discussing problem behaviors. Often parents will say, I want this behavior to stop, but the question is, how severe or disruptive is this behavior? We want to honor a parent's request, but sometimes we need to paint a clearer picture for them. If a learner is vocally scripting, do we really need to stop it? Can we allow them to engage in this behavior on their own time? Not when they're at the table learning or working. But when they're on their break, that might be okay. So that's something to keep in mind. Any treatment team member that has read and signed this policy must ensure professional, legal, and ethical practice. Any team member that violates this policy will face serious consequences. It is essential that all team members understand this policy and ensure the safety of their learner and self. Ignorance of these procedures will not generally be accepted as an excuse for non-compliance. only in extreme circumstances and where such ignorance can be demonstrated to have occurred through no fault of the individual concerned with the center. Any team member that witnesses or suspects any form of child abuse must report it immediately to their supervisor or the BCBA. Any team member that violates the BACB Code of Ethics must engage in self-report, or others may report them to the supervisor or the BCBA. Serious violations will be reported to legal officials or the BACB. Physical abuse, which includes punching, kicking, slapping, choking, pinching, shaking, hair pulling, scratching, and so on. Administration of any stimuli which causes pain or discomfort, verbal abuse or threats which are demeaning or intended to instill fear, deprivation of liberty or freedom, needs personal property, the use of medical attention for any reason other than that for which is prescribed and or intended. Notification of abuse, where a staff member suspects that a person is being abused or neglected or through their own conduct is jeopardizing their or others' health, safety, or welfare. It must be reported as per the mandatory reporting policy. Why am I saying all this to you? When we handle problem behaviors, anything can happen. Dealing with behaviors can be very stressful, can be emotionally exhausting, and when this happens, a person may engage in unethical or illegal behaviors. When we get to abuse and ethics, you'll understand a lot more. So it is critical that we notify all staff and RBTs of the legal and ethical requirements and to know that it is their responsibility to protect and care for the client. Your responsibility is to ensure that staff have access to relevant training and are able to demonstrate competence in supporting people who exhibit challenging behaviors. To ensure that clients with a history of challenging behaviors are a priority for behavior intervention. To ensure the regular review of behavior interventions with the team. To ensure that debriefing and counseling are available to the people involved in critical incidences involving challenging behavior. This would include the family members and other clients and staff members as well. To ensure that significant others are invited to participate in identifying the person's support needs. To support the client in a way which promotes positive interactions. To support the development of the client by following all procedures as specified in the client's behavior intervention plan. To prevent and protect self and others from injury. To reduce unnecessary damage to property. To implement any necessary reactive strategies using a least restrictive approach. To understand triggers that set off your learner, identifying them with your supervisor, and add them to the behavior plan. This is to help minimize future problem behaviors. Never to tiptoe around your learner's triggers, but to address them with your supervisor. To have instructional control and work with your learner in a positive and fun environment. To ensure that your hair is tied back, nails are clipped, and that you avoid jewelry and ensure proper shoes are on your feet. The environment needs to be safe. No scissors laying around or dangerous objects. No clutter on the floor which could cause more injury. Remember to always speak to your supervisor about problem behaviors. Everyone is good at making accommodations to avoid behaviors, but this is not best practice. It is important that we address the triggers to provide a better quality of life for the learner and their family. While proactive strategies will produce positive effects on the client's behavior, the challenging behavior will still occur to some degree. Although it is to be expected that it will occur at a progressively decreasing rate, nevertheless, when the problem behavior occurs, therapists need strategies that can be used to minimize the risk of harm to the person or others. These are called reactive strategies. It is essential to remember that when the challenging behavior is occurring, this is not the time to try to teach the person anything or make a point. At this time, the goal is survival with dignity, What I mean here is often when a problem behavior occurs, therapists want to teach the learner something, but the reality is when someone is in a heightened state, we can't really rationalize with them. We need to de-escalate them. We'll discuss this further in our emergency protocols class. Behaviors. If you recall back to our behaviors and environment class or our functional behavior assessment class, behaviors are things we say or do. There is always a reason why behaviors occur, and there's an interaction between the environment and the behavior. Young children will often engage in problem behaviors because of their inability to communicate effectively. If language ability doesn't strengthen, these behaviors can continue to exist. For example, a child may flop to the floor or engage in crying if they can't ask for something they want, or maybe they don't want. A behavior plan is needed when a learner is engaging in dangerous and harmful behaviors, which may be causing harm to others, property, or self. Behavior plans are important because they provide information about the behavior and how to deal with those behaviors. A behavior intervention plan is a plan that is designed to teach and reward positive behaviors. This can help prevent or stop problem behaviors in school, home, or treatment centers. The behavior plan is based on the results of the functional behavior assessment. The behavior plan describes the problem behavior, the reasons that the behavior occurs, and the intervention strategies that will address the problem behavior. The treatment team may determine what skills are lacking that are needed to handle certain situations. For example, if the learner is unable to wait for a reinforcer, a program may be established to teach the learner to tolerate waiting while addressing the problem behavior. A behavior plan can help the learner learn problem-solving skills and better ways to respond in that type of situation. Plans can tackle a variety of skills. We can teach a learner to ask for breaks, teaching the learner calming techniques, and so on. The plan must have a reinforcement schedule built into it. We can't just address problem behaviors. We also need to reinforce the new skill or behavior. Would it be ethical to punish the problem behavior without teaching the learner new skills? Absolutely not. So you need to look for that in the plan. Behavior plans can differ, and not all will look the same. I want to review some of the essential parts that you may see on a behavior plan. There are about 9 parts of the behavior plan. The first is the date of the plan. This is when the plan was introduced and commences. Then, the learner's identifying information. This can be the learner's name, address, family information, and so on. Then, the target behavior. This is the behavior of concern. What are we trying to reduce here? Or sometimes it's something that we're trying to increase. We may be looking at decreasing property destruction or increasing on-task behaviors. Next is the operational definition. This is the behavior described in observable and measurable terms. Remember, we talked about behaviors being described using verbs. A plan that says angry or frustrated does not give you a clear idea of what that looks like. Next, we have the behavior reduction procedure. This is the actual protocol, how we will step by step reduce the behavior. Then how to track the behavior and graph it. Next, the review date, which states when the plan will be revised if needed. And of course, the parental consent and signatures, along with the date. And finally, the supervisor, the BCBA's signature, and the date that it was signed as well. The idea of the behavior intervention plan is to reduce the problem behavior and replace it with something that is equivalent to the problem behavior. Knowing the function of the behavior will help in the design of the treatment plan that is equivalent to that problem behavior. All right, let's do a Scrabble word before we continue. The word is manse, spelt M-A-N-S-E. And this is a house occupied by a minister of a church. And the word is manse. All right, let's continue. Before we can deal with any type of behavior, we need data. Data, data. Your supervisor can interview the parents, teachers, therapists, or others who interact with the learner. The behavior will be observed. A functional analysis may be conducted. And finally, then we can get to treatment. So we can look at two things. One is the topography of the behavior and function of the behavior. The topography is how the behavior looks. This will not help us determine treatment, but will help us describe the behavior. For example, the topography of behaviors, aggression such as kicking, pulling hair, pinching, self-injurious behaviors like biting self, eye poking, property destruction such as ripping teaching material, clearing the table, throwing chairs, and problem behavior or tantrum-like, which may be flopping to the floor, screaming, crying, and so on. Next, we have the function of the behavior. This is a crucial part in analyzing the problem behavior. We need to know what is maintaining the behavior. Let's go through each one. Before I do, let me throw out some scenarios. Think about them. As I go through them, think about the person's motivation. Okay, so someone walks up to you and says, "Nice dress." You're driving down a road and about to make a right-hand turn, and the person in the car with you says, No, don't turn right. You're singing in the shower. So, someone walks up to you and says, "Nice dress." Are they really saying nice dress, or are they trying to talk to you and start a conversation? Often we look at behaviors as they seem to appear, but often we need to dig a little deeper. The person who told you not to make a right-hand turn, well, why would they do that? Why would they say that? Why would they care if you go right or straight? Well, what if there is a place down that other street and causes them some anxiety in a sense? It's an aversive place that brings back bad memories, and they really don't want to see it. What about you singing in the shower? Well, most often we sing in the shower because we like to hear the sound of our voice. It's reinforcing to us. And so we sing in the shower. We engage in behaviors every moment. And why we do has its function. You can have the same looking behavior, but with different functions. Let's get into the functions. So the first one is attention-seeking behaviors. And these are when the learner will use inappropriate behaviors to gain an adult or peer's attention. Now, of course, a learner may use appropriate behaviors to gain someone's attention, but I'm focusing more on the ones that are problem behaviors. The function of the behavior here is attention-seeking. The learner engages in behaviors to capture someone's attention. The learner will use different forms of behavior such as screaming or kicking, flopping to the floor, or clearing the table, banging their head, or hitting others, climbing on furniture, and looking at your reaction. Two things happen with attention-seeking behaviors. People either attend to the behavior or they may ignore it completely. What you should do when you encounter these types of behaviors would be to speak to your supervisor or the behavior analyst on the team immediately about any of these kinds of behaviors. Document the behaviors using ABC data and avoid attending to the behavior as much as possible, but always ensure the learner's safety. Before we move on to gaining access to reinforcers, let's take a quick stretch and do a Marvel character. The character is Goose, the cat. If you've seen Captain Marvel, you'd know she's not just a cat. Okay, ready to get back into it? The learner will use inappropriate behaviors to gain access to tangibles like toys or snacks or activities. The function of the behavior here is gaining access to a reinforcer, and the learner engages in problem behaviors to get a preferred item or activity. The learner will use different forms of behaviors such as a scream, kick, flop to the floor, hitting, and so on. There are two outcomes when dealing with this type of behavior. You may be giving an item which calms the behavior down, or you give the item contingent on the problem behavior, which may increase the behavior over time. Children that do not have strong vocal or requesting skills will often engage in such behaviors. By reinforcing these behaviors, learners are not using functional language. It's best to teach a method of communication, reinforce the new behavior, and put the inappropriate language on extinction. And that is to no longer reinforce that behavior. Again, two things might happen with this behavior that are maintained by gaining access to reinforcers. People will either give the learner the item or they ignore the behavior. Keep in mind, we should always encourage new and replacement behaviors. Don't reinforce the old unwanted behaviors. So what should you do when you come across this type of behavior? Well, as I previously mentioned, you always want to speak to your supervisor or behavior analyst on the team immediately. And always document the behavior using ABC data, and remember to avoid attending to the behavior. But always, always keep in mind the learner's safety. Escape motivated behaviors. The learner will use inappropriate behaviors to avoid or escape a task or instruction. The function here is escape motivated. The learner engages in behaviors to avoid or terminate a demand. The learner will use different forms of the behavior, such as banging their head, hitting others, screaming, kicking, and so on. By letting the learner leave a task or avoid it, it will likely increase the future occurrence of that behavior. Just like the previous behaviors we mentioned, two things can happen. The learner will be allowed to escape, or the learner's behavior will be ignored. Remember, always speak to your supervisor and document the behaviors. Automatic reinforcement. There are two types: automatic positive reinforcement and automatic negative reinforcement. The function of automatic positive reinforcement is gaining sensory stimulation, and the learner engages in behaviors to stimulate different senses. These behaviors include rocking, thumb sucking, eye blinking, flapping hands, and more. These are repetitive movements that the learner engages in, which stimulates different parts of their body. The function of automatic negative reinforcement is removing painful stimulation. This may include scratching, shaking hands and arms, headbanging, and so on. Remember to speak to your supervisor or behavior analyst. Document all the behaviors using ABC data. Don't react, and think prevention. If you can prevent the behavior, then you try to do so. You don't want to trigger behaviors when you don't know what to do when they occur. Speak to your supervisor and notify them about the behavior so that it can be addressed. If there is a behavior plan in place, run the steps to address the behavior. If there is no plan in place, attempt to prevent it in the meantime. Okay, so let's move on to problem behaviors, the function, and what to do to prevent it. But before we do, go ahead and take a little stretch and get ready for our secret word. The word is dragon fruit. I'm not going to spell that for you. Again, the word is dragon fruit. Okay, let's continue. So you're faced with a problem behavior. You can use antecedent interventions or operant strategies. Antecedent strategies look at manipulating what happens before the behavior. We'll discuss this in our antecedent manipulation strategies class. With operant strategies, we're looking at what follows the behavior. Do we ignore it or do we reinforce it? So here's an example. Your learner does not have the words to ask for items or activities, and they're engaging in problem behavior. Which one would be the appropriate function? I'll give you a few seconds to think about that one. Okay, so if you said gain access to reinforcers, then you're right. The learner is unable to ask for something they want and are therefore engaging in problem behavior. Children or individuals that do not have strong verbal behavior are more likely to engage in problem behaviors. Learners will scream, cry, flop to the floor, engage in aggressive and self-injurious behaviors. Functional communication training, or MAN training, will teach the learner effective ways of asking for things rather than engaging in the problem behavior. So how do we deal with behaviors? The learner is grabbing for an item and begins crying and screaming. What do? Do you give it to the learner? Would giving the item to the learner following that problem behavior reinforce it? Keep in mind that when you give the item contingent on the behavior, it will increase the likelihood of that problem behavior in the future. So you need to make sure you leave a gap in time before giving the learner that item that they're requesting. Teaching appropriate MANs to replace these behaviors is best. We don't want to just work on the problem behavior and reduce it without focusing on the function of that behavior. So teaching the right skills will be essential. This is your supervisor's responsibility, but it's important for you to understand that you may need to let your supervisor know the details of the situation so that they can address the problem behavior accurately. Something that we use at the center is a count and man procedure. This is a procedure that was described by Carbone. Has been a very effective procedure in not reinforcing the behavior, but creating this gap between the problem behavior and access to the reinforcer. Remember, never implement a strategy without the approval of your supervisor. Be sure to discuss the issues, take data, and know your learner. Not every procedure will be effective on your learner. I want to walk you through what we do here at the center. When a learner engages in problem behaviors to access a reinforcer, we block all access to their reinforcers. We ensure that they're safe, and we say wait or quiet or similar language. Once the learner is quiet, we count to 5. And then we model the correct behavior and reinforce it. If the learner echoes, of course we're going to reinforce that. If the learner does not and is unable to echo, then we model the language and we just give it to them. Now, what happens if the learner begins engaging in problem behavior while you're doing the count? Well, we typically just restart the count and repeat this until you get a count without problem behavior. The count and mand is an effective procedure because there is this delay, a time delay between the problem behavior and the mand. We don't want to chain the problem behavior with the mand. You want to have a nice break between the two so that we're not reinforcing the problem behavior. You can record the number of count and mands that you've done and the number of times that you restarted it. Initially, the procedure may take a long time before the learner settles down. This will decrease over time. Remember, if this is a behavior that has not been reinforced for a while, it will take time for the learner to learn this new method of requesting. Be sure not to give in halfway through. Here's another example. You're jotting something down and you're focused on your data sheet, and the learner engages in problem behavior. Which would be the appropriate function? I'll give you a few seconds to think about that one. Now, if you said attention seeking, then you're right. Your attention was diverted from the learner, which may have triggered them to engage in problem behavior. When you have a learner that engages in problem behavior because your attention is diverted from them, you want to teach them how to get your attention appropriately. They can learn to tap you on the shoulder, say excuse me, or hey, look at this, rather than using problem behavior. You can also teach your learner to wait without you constantly paying attention to them. These would be great programs that could be added to deal with these kinds of problem behaviors. You can also simply ignore the behavior. However, just ignoring the behavior doesn't teach the learner what to do. So it's up to us to teach them the appropriate ways of gaining someone's attention in the right moment. Here's another example. Your learner is sitting on the floor with a book alone. You're about 5 feet away and the learner engages in head-shaking behavior. Which one would be the appropriate function? I'll give you a few seconds. If you said automatic reinforcement, then you're right. This is often when the learner is alone. No one is providing any attention to the behavior and it happens. We often see our learners engaging in hand flapping, body shaking, or even vocal stereotypies. They may be engaging in these to stimulate themselves. Many have asked, well, I have a learner that engages in handshaking when they're excited. So is that still automatic reinforcement? Well, doing the handshaking probably feels good to them. So yes, it could be. So here's another example. Your learner is sitting at the table with a puzzle in front of them, and you're about 5 feet away. The learner engages in head shaking behavior. Which one is the appropriate function? Did you say automatic reinforcement? Or did you say escape motivated? Or was this just a hard one? This can often get very tricky for therapists when they're looking at a behavior. We often associate head shaking or hand flapping with automatic reinforcement only. But learners may actually be engaging in these types of behaviors to escape a task. Learners can quickly learn what sorts of behaviors can get them out of things. Let me share a story with you. We had a learner that started with us who had a difficult time separating from his mom. His mom would say, "Please call me," if he starts crying, because usually that would end up in him throwing up. All that crying would trigger the throwing up. So we were on the lookout. When I observed the behavior, I noticed something very interesting. When his mom was in the room, he started crying and hanging on to her. Then he would begin to gag. If the gagging was not working for him, he would stick his fingers in his mouth to make himself throw up. His mom would quickly react, calming him down and picking him up. So I asked Mom if she could stand outside of the room so we could try to work through the behavior. What I found was when he attempted to gag or throw up, we placed a clean garbage pail in front of him so he could throw up in it. He would immediately stop and say, "No pail." What we found was he was in control of that behavior to a certain degree. And what maintained that behavior was his ability to escape something he didn't like. So keep that in mind. When you're working with your learners, some behaviors can be controlled by your learner. So knowing the function is the key. And your supervisor will be there to support you in understanding that function. So what do you do with a learner who is escaping a task or situation? Well, it's up to you and your supervisor to sit down and determine what they are escaping. Is the task too difficult? Is it too boring? Are you not reinforcing enough? Or have you not determined reinforcing items? Has the learner been working for too long without sufficient breaks? These are all important questions to think about even before speaking to your supervisor. Knowing why or asking yourself why will help both you and your supervisor. So remember to be analytical and think about why. Why are they escaping? Why are they engaging in this behavior? What are they trying to tell me? Why else may someone be engaging in problem behaviors? What about setting events? The learner is hungry, thirsty, hot, tired, sick, or something has changed at home. These setting events may be factors that increase problem behavior when demands are placed. I want you to imagine that you're tired because you didn't sleep last night. You're given many tasks to do. Chances are you'll become more irritable and snap at someone. Children are the same way. Look at your learner and ask yourself these questions. Are they hungry? Thirsty? Did the parents update the therapist about the night that they had? Was it a rough night? Maybe they didn't eat breakfast. Is the learner sick? Are they on new medication? Communication is crucial. So any updates from parents, be sure to notify your team and supervisor. When a learner is asked to engage in a task but the therapist has not established instructional control, the learner may engage in problem behaviors. To establish instructional control, you must give your learner instructions, follow through with them, and reinforce compliance. The learner will quickly learn that when I follow this person's instructions, I'll get reinforced. When the learner engages in inappropriate behaviors, the learner will also learn that they will not get a reinforcer or it's delayed. As you can see, determining the trigger is essential. So an FBA must be conducted first, Then the behavior plan is put together, and executing that plan will be your top priority. The FBA aims to identify the function of the behavior through observation of that behavior, evaluation of the person's interactions with others, and evaluation of the environment and the person's lifestyle. The assessment can determine if an individual's needs are being met and the areas requiring improvements. It can determine a person's skill and competency levels, define the frequency, intensity, and duration of the behaviors. It can define the motivation and reinforcers of that behavior, determine the antecedents and consequences. Information provided through an assessment assists in planning strategies to avoid behaviors before they occur and assists in reducing the occurrence of behavioral incidences and ensures personal growth through continued competency enhancements. The supervisor and therapist will work together to answer these questions during the assessment. Using the Hanley questionnaire, the supervisor and therapist can work together to pinpoint possible triggers. All right, we're about to jump into the quiz, then end off with my final thoughts. Good luck. The learner is banging on the table as you are speaking to another therapist. What could the possible function of the behavior be? A. Attention seeking. B. Escape motivated. C. Gain access to reinforcers. D. Automatic reinforcement. Or E. Cannot be determined. And the correct response is A. Attention seeking. What is the purpose of the behavior intervention plan? A. To punish a learner's behavior. B. To help you deal with the behavior. C. To teach new skills. Or D. All of the above. And the correct response is B. To help you deal with the behavior. The learner is doing a puzzle on the floor and begins shaking the puzzle piece. What could the possible function be? A. Attention seeking. B. Escape motivated. C. Gain access to reinforcers. D. Automatic reinforcement. Or E. Cannot be determined. And the correct response is D. Automatic reinforcement. The behavior intervention plan is A. Based on the results of the FBA. B. Based on the results of an FAA. C. Based on the results of an IEP. Or D. None of the above. And the correct response is A. Based on the results of an FBA. You give your learner their sandwich and they push it away. What could the possible function be? A. Attention seeking. B. Escape motivated. C. Gain access to reinforcers. Or D. Automatic reinforcement. Or E. Cannot be determined. And the correct response is B. Escape motivated. Why may a child engage in problem behavior? A. Because kids are kids. B. Because they think it's funny. C. Because of their inability to communicate effectively. Or D. None of the above. And the correct response is C. Because of their inability to communicate effectively. The learner is kicking and screaming after you take away the iPad. What could the possible function be? A. Attention seeking. B. Escape motivated. C. Gain access to reinforcers. D. Automatic reinforcement. Or E. Cannot be determined. And the correct response is C. gain access to reinforcers. Why may a child engage in problem behavior? A. Setting events. B. Satiation. C. Difficult tasks. Or D. All of the above. And the correct response is D, all of the above. Remember, if something has changed at home, or they're on new medication, or maybe they're hungry, thirsty, these are all setting events. These could trigger problem behavior if, let's say, a demand is placed on the learner. If the learner is bored, maybe they've satiated from the items or the thing that they're doing, that may trigger problem behaviors. Or difficult tasks. If you're presenting the learner with difficult tasks, that may also trigger problem behaviors. So the answer is D, all of the above. What could you do if your child is engaging in problem behaviors? A. Add a punishment procedure immediately. B. Take ABC data. C. Teach replacement skills. D. Both A and C. E. Both B and C. F. None of the above. Or G. All of the above. And the correct response is E, both B and C. What does the FBA provide? A, aims to identify the function of behavior. B, identifies skill deficits. C, identifies the frequency, intensity, and duration of the behaviors. D, both A and B. E, all of the above. Or F, none of the above. And the correct response is E, all of the above. The learner is throwing toys in the classroom. What could the possible function be? A, attention seeking. B, escape motivated. C, gain access to reinforcers. D, automatic reinforcement. Or E, cannot be determined. And the correct response is E, it cannot be determined. There's not enough information here to tell us why the learner is throwing toys in the classroom. It could be automatic reinforcement if they're enjoying the sound of it. Maybe they're escaping something. Maybe they're trying to gain the person's attention. So an FBA would need to be conducted here. My final thoughts. Behaviors can look the same, but have different functions, as I've mentioned. A learner may hit their head to gain your attention, but they could also hit their head to gain access to an item. Imagine you're working with the learner and they hit their head. You might be inclined to stop the behavior by holding their hands down. But by simply stopping the behavior, we're not dealing with the issue. We're simply momentarily stopping the behavior. That's where ABC data or observing the behavior comes in. Is the learner hitting their head to get your attention or to get an item? For each behavioral intervention plan, there is likely to be the expectation that therapists will contribute to monitoring and evaluating the success of the program or plan. Therapists will be expected to record each behavioral incident and report each incident where there is a threat of property damage, physical injury, or harm to any individual in the environment at the time of the incident. A behavior plan, just like a skill acquisition plan, is really important. It outlines the steps we need to take to improve skill or behavior. Read through the plan thoroughly. Be sure you are trained on the implementation of that protocol. Never do things outside of your training or competency. Once you know what to do, you'll feel very confident. Challenging behaviors serve a necessary function for a person and are usually a result of a person not having his or her needs met. The quality of life issues that face many people with intellectual disability or an acquired brain injury and who present with challenging behaviors, they often lack interests. They lack opportunities for freedom and choice. They lack the ability to communicate. Lack of training in coping skills. The assumptions for any behavior management plan are that all people have the potential to learn. Challenging behaviors occur for a variety of reasons and are learned and effective tools for having a person's needs met. Behavior is controlled by the environment and interactions with which a person lives. Behavior can be affected by medical, physiological, psychiatric, and psychological problems. Behaviors can be affected by social expectations and attitudes. This is with a holistic approach to assisting a person with challenging behaviors. More effective supports can be provided, and the person can learn to cope and respond to life in more appropriate ways without having to resort to challenging behaviors. Why behaviors happen will help us do better for our clients. What a behavior looks like is great in helping us describing it, but doesn't tell us why. That's where functions come in. Is your learner doing this because they want your attention, or are they escaping something? The next time you see someone's behavior, ask yourself, why? What are they trying to say? I'll end off with a quick and funny story. In my first year of university, many years ago, I was standing in line waiting for class to begin. It was the first day of class, and you can imagine everybody was nervous. A classmate walks up to me and asks for the time. What made me question his motivation was the fact that there was this huge clock on the wall beside us. I looked at the clock and I read the time. Why people do what they do is interesting. So enjoy observing behavior. Until the next time. All right, so we talked about form and function during this talk, and what I want you to do is watch what we're doing, and I want you to identify the form of the behavior or the topography of the behavior. I find a lot of people struggle with this, so please jot down the topography or form of the behavior. Here we go. Okay. Show me the pants. Find the fish. Where's the bear? Touch the zebra. So identify the topography of the behavior. Find the bear. Do this. Where's the zebra? Find the fish. What color?
Red.
Show me the bear. Where's the squirrel? I'm going to go through this with you guys because I want to make sure that you guys got the topography of the behavior. The first one that you saw was hitting. The next one that you saw was that the learner, instead of pointing to the picture card, they went and they slapped the picture card or were banging the table in that instead of pointing. So banging the table or slapping picture card would have been the topography. And the final one was the learner started to engage in some, banging their fists onto the table. So those were three topographies or forms of behavior. Now it's important for you guys to identify the form and function, but in the situation that you guys just saw, those three examples, what were the functions? Now in this situation, if you said that it was to escape the instructions or just escape, then you might actually be very right. Now, again, sometimes the function is not clear and it's not just a single function. It could be a dual function. Most often, learners are escaping a task to gain access to a reinforcer. So if you wrote down escape, that could be correct. Again, we need to really look at all the elements of, the situation. When do these behaviors happen? Do they only happen at the table? Is it with a specific program? What conditions is it under? And what are the consequences in which the instructor or teacher, implement after that problem behavior? If they provide attention, well, maybe that's what's maintaining the behavior. So it's very difficult to analyze the behavior in this sense. But if you said escape or gain access to a reinforcer, I mean, there isn't a reinforcer present at this time, but chances are they're escaping so that they can go and play or they can get their iPad. So when you're dealing with problem behavior, it's really important, one, that you are communicating with your supervisor to let them know that you are experiencing some problem behaviors, let's say at the table while teaching, so that they can come and analyze the situation. Now, of course, taking ABC data would be great, because then you can identify that when you're working at the table and, let's say, running the receptive program or running through your high probability cards, the learner engages in, and you would describe what that behavior looks like, so the form or the topography, so maybe banging their fists on the table or slapping the picture cards. Then the consequence will be, well, what did you do? Did you say to the learner, stop, don't do that? Did you allow the learner to escape the task and go and play? What did you do? And so again, that's important in the analysis, so we can understand what may be maintaining this problem behavior. Do this, do this, do this, do this.
Yeah, give me.
Whatever. So, did I do the right thing in that moment? I'll give you a few moments to think about it, and then I'll demonstrate what you could have done if this was the procedure you were using. Okay, so I hope you thought about it. Now, what I'm going to do is walk you through the count and man procedure. Again, the count and man procedure is great for learners that aren't requesting for something and they grab the item that they want without requesting, or they engage in problem behavior. This is great to use. Now, of course, you only want to use a procedure that is authorized by your supervisor. So be sure that you've spoken to your supervisor about this. If you don't have anything in place, then you may say, what about we do a count and man procedure? This would be great. I think it could really work on little Johnny. But of course, always speak to your supervisor and ensure that it is based on that function, because we're always working on the function of the behavior. We're not looking at the form of the behavior, we're looking at the function. So the function here is to gain access to the reinforcer. Do this, do this, do this, do this. Wait, 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 1, 2, 3, 4, 5. Phone. Good. Great. So as you can see here, I told the learner to wait until they showed calm. I counted to 5 so I could have that break. And then once that was done, I modeled the correct language and delivered the reinforcer contingent on the correct behavior, which is them saying phone. The other thing that I want you to have noticed is that I had my timer and I timed the behavior. This is really important because when you're working with a learner who is engaging in problem behavior and you want to go back to your supervisor and say, little Johnny or little Janie is engaging in problem behavior at the table, or we're taking data on the count and man, it's really important to have your timer there so that you can give your supervisor some data. Now, of course, if you are doing a protocol such as this, you should be taking data. Now, depending on whether you're looking at the frequency of count and mans that you guys are doing through the day or the length of each behavior, that you would have to determine with your supervisor.